All right. So I'm going to share my screen here. And okay, here we go. All right, so I apologize in advance if I'm kind of looking over in this direction. Rather than printing out my notes, I'm looking on my other screen and my camera is here, so you get it. Let's see if I can get the chat box up here.
I am literally doing the exact same thing as you are in this moment.
About two screens?
Yeah, so my camera is on this side here, but I've moved you guys to my bigger monitor over here, but doesn't have a camera. So
Yeah. Okay, no problem. Well, we'll both just be looking in the wrong place. Okay, so this is obviously counseling theories, right? Like this is the title of the class. So what is a counseling theory? That's what we're going to be talking about this semester. Anybody have some ideas of what a counseling theory is?
Is it the foundation of how it's basically peer-reviewed research that's built upon, and it's the foundation of how we perform counseling with our clients today?
Yeah, it's basically like what, particularly that latter part there, it informs how we work with clients and what we do when we're counseling. The peer review, the empirical part, that's the part that can kind of get a little bit fuzzy with some of the theories that we're going to be talking about, but we will hit on that. But that's a great definition there, Jessica. So let's see here. Okay, so for the purposes of this class, we'll think about a theory as being basically a working hypothesis that explains why a client is experiencing problems or symptoms, like, how did they get to be the way they are? And what are some of the interventions that we can do to promote healing, change, or growth? So it's kind of got two parts to it too. There's a sort of like prescriptive part, like what we're going to do, the intervention part, but then there's also this other part that is explanatory. So it explains something and it also prescribes something. And they all have that in common. Let's see here. Oops. Okay, so the model with which I am going to be talking a lot about and trying to help compare, conceptualize, categorize our theories is something called the transcultural model of healing. And it was developed by these two guys, Frank and Frank. And this is the lens through which we're going to be talking about all of these theories. And the way that the transcultural model came into being was that it was really based on this very large scale study, kind of inquiry into all the systems of healing around the world, therapy and otherwise, from, going to see a shaman for ayahuasca treatment in South America to, going to see the dermatologist for acne. Like, what are healing all around the world? Like, what does healing have in common? And Frank were really interested in explaining what happens, what is the sort of process, what goes on when a troubled person gets better. And by looking at all of these different types of traditions around the world, they identified basically four things that each of the healing procedures had in common. And that's how we're really going to conceptualize our theories of counseling, because even though it may not seem like counseling has that much to do with going to see your shaman or going to see your dermatologist, in a lot of ways, it's kind of the same stuff. And so that's what we're going to be looking at today. So what Frank found was that the features that are shared by all forms of healing, including all of the psychotherapies and counseling, these four features really account for the majority of the reasons that they're effective. So the features that they found that seem to kind of matter, that seem to explain what happens when people heal, are, first of all, the relationship. So this is an emotionally charged connection between a provider and a receiver. And we'll talk about more about each of these in the next slide. I just want to kind of go over them generally. This idea of expectancy. So what does the client expect to happen? Here's the clue: they expect to get better. Myth. The myth is sort of the explanation of what is wrong and how it's going to get better. And then the ritual. So the ritual is sort of the procedure or the intervention for resolving the issue. So those are the 4 things that Frank and Frank identified that are common to all healing traditions, including all of the psychotherapies and counseling theories that we're going to be talking about. So just to kind of go into those in a little bit more granular detail, we're going to start here just by talking about the relationship. So the first one, the most important one, the one you're probably going to hear most about in your other classes, is the idea of is this relationship. And that is this emotionally charged, confiding relationship with a helping person. Sometimes there might be a participation of a group, for instance. And the client feels that within this relationship, that the healer, whoever that person is, has genuine concern and care for them without any ulterior motives. So that's one way in which healing is different than other sorts of relationships that you might have. Like you might have an emotionally charged relationship with your mother, but I can pretty much guarantee you your mother has some ulterior motives in that relationship. She wants something out of it. You want something out of it. It's all complicated. And we all have relationships, so we can kind of get that. But with healing, that healer isn't going to get anything back other than potentially compensation. But they're not trying to get anything really out of the person who's come to see them. And so it's really kind of one directional. And this helping alliance really has a couple of aspects to it. A big one is the idea that the healer, the therapist, the counselor really has an acceptance of the sufferer. So they're accepting that they're in pain. They're accepting the idea that life isn't the way that they wanted it to be. If not for kind of like, and there's a sort of acceptance of the person, if not for sort of who they are in the moment, but sort of for what they can become, that they have this belief that this person can kind of grow and that they can change and they can kind of improve. And that's part of what the relationship is. It's really about this sort of benefit of the receiver. So the next feature of the transcultural model is the idea of expectancy. So expectancy has a couple of pieces to it. The first piece is the sort of socially sanctioned position of the healer. So, we think about, the socially sanctioned position of a counselor. There's someone that you go see when you have a problem. If you're living in South America, you go see the shaman because they're this person who is socially sanctioned and they have this position of the healer. And that's part of the expectancy part of it. And there's often a special context or setting. So a sort of set and setting, as you might imagine, like a mindset that the person has, and then a different sort of setting that really demarcates that experience from other parts of their lives. So, Zoom is a little bit, Zoom exactly kind of like collapses it because, people are getting counseling in their houses where they live, and, children are screaming around and they're living in, the normal mess. But ideally, in the world where we're not living in a pandemic, you go to someone's office, and it's a different place, and it's, so it's sort of a temporal and some spatial boundaries where this procedure is going to be taking place. And it's different than the ordinary life of the client. It also offers some safety too. So perhaps you feel more capable of talking about what's really going on when you're in this space because, no one's like listening in on your Zoom call. And then the second part, the sort of big part of the expectancy is this idea that like the client believes that the counselor is going to be helpful. So that's this other part of this expectancy, this sort of belief that it's going to be efficacious, that it's going to be useful to go and invest this time and this money going to see this healer. Questions about relationship or expectancy? Anything so far? And the other part of this, obviously, is that the healer believes that the myth that they're telling, they also believe in it. It's a little bit like the placebo effect. People, I think, disparage the placebo effect because they think, oh, that just means it's all in your head. Placebo effect can be really powerful. They've done these studies in Germany where people have gotten like placebo ACL surgery. You know, like your ACL is this like ligament in your knee that if you wreck it, it's not like going to grow back or anything. So you kind of like have to get it replaced. And so these people like got this placebo surgery, and they were in fact told that they were going to get the placebo surgery, and they got better. Like they just like opened up their knee and then closed it right back up. And like the sort of belief that somehow this surgery was going to help them get better. So placebo is really some powerful stuff. All right, so we'll move on to myth. And so the myth is really the explanation for the nature of the client's problem. And that also provides a rationale for the healer's actions. So it's, this plausible explanation for why the client has these particular symptoms. And each of the theories that we look at are going to have unique explanations for why people have problems. And then it will prescribe a ritual or a procedure for resolving them. And we choose the word myth, or Frank and Frank chose the word myth because in a certain way it's more, and the theories of counseling in a lot of ways resemble myths more than they do like scientific theories. So if you think about Freudian theory, it's not exactly like quantum mechanics, right? I'm not going to explain quantum mechanics right now, so we'll just have to kind of like be cool that they're different. All I've kind of been able to surmise is that stuff is actually space. But that's really different than, Mary, you're shaking your head, you're like, that's not what it is.
I'm saying I have no idea.
Okay, all right, but you can see maybe in a simpler one is the theory of gravity. Like theory of gravity is very different than, Freudian theory. You can, drop a hammer on your foot and you're gonna prove gravity a lot more easily than you can kind of prove Freudian, the tripartite structure of the psyche. So anyway, why would we use the word myth? The first is that the stories that we use in counseling and in psychotherapy, they're sort of imagination catching. They're somewhat colorful. And the second feature of why we would call them myths is that they can't be proved empirically. So to go back to Jessica's point earlier about the peer-reviewed thing, we can certainly measure the efficacy of a treatment, but we can't really measure whether or not that theory is true. So it's this weird leap of faith that you make when you pick a counseling theory. And part of that is that, when there's success, it's taken as evidence of the theory's validity, often erroneously. And failures are sort of explained away by sort of saying that something went wrong, they didn't really adhere to the theory. So it's kind of like it's like very anti-scientific in a certain way. But even scientific theories are really hard to prove. It's kind of like what the scientific method is, right? You're like rejecting or failing to reject the null hypothesis. And then lastly, the last feature of healing traditions is this idea of the ritual. And the ritual is the technique-y bit. This is the sort of toolbox that the healer has for resolving the client's particular problems, either some sort of technique, a procedure, intervention. You think about whether if we're not talking about counseling, if we're talking about dermatology, the dermatologist maybe tells you to use those red LED lights or something, or to give up sugar or don't eat dairy. So that would be the sort of ritual for a dermatologist. And really the ritual requires sort of participation from both the counselor and the client. And both of them not only have to participate, but they also have to believe it's going to be helpful and going to be effective. So if your counselor is doing something that you think is total hokum, it's probably not going to work, right? I once had a counselor who was doing all this like chakra work, and I remember just thinking to myself, like, I do not believe in chakras. I'm going to do this anyway because I want to be a client that is a good client and not get into this conversation. But I was like, I do not believe in chakras. And so thus it was not a very helpful ritual or intervention for me because it's not one that I really believed in, but to each his own, right? All right, questions about the myth and the ritual. All right, we continue on. Okay, so this very lovely slide is basically like the common factors. This is often called like the common factors model. And it's really like an empirical, it's kind of the empirical data gathering that Frank and Frank kind of hinted at in their conceptual framework. And this is basically an illustration of what kind of the research suggests accounts for the success in counseling. So when someone gets better in counseling, how does that happen? Like, what is really at work here? And when we look at the research, what we find is that the client or the sort of extra therapeutic factors count for about 87% of the change in counseling. It's a lot, right? Like, there's a sort of joke that's like, how many clients does it take to change a light bulb? Wait, how many counselors does it take to change a light bulb? Depends. Does the light bulb really want to change? Like, I'm sure you've probably heard that joke before, but it's the same sort of idea that like the majority of what's happening when it comes to change is really kind of, it resides with the client or the sort of extra therapeutic factors. So extra therapeutic factors include things like the elements that really, the client really brings with them to counseling. So their knowledge base, their life experiences, their strengths and abilities, their readiness to change, their motivation for treatment. These are all kind of like extra therapeutic factors that, along with the client, really account for like 87% of what goes on, which means that the treatment part, the part that we have control over, only accounts for about 13% of what's actually going on. So what this means, is that it really doesn't make a huge deal. The choice between one theory of counseling and another theory of counseling is really not that big of a deal. So if you look in here, of the 13% that is due to the treatment, the therapist effects, like sort of who you are, what you're like, what your experiences are, how connected you are to the client, that's like 46 to 69% of the 13%. The alliance, so that kind of relationship, that feeling of like you're working on this together, that's another big chunk of the 13%. The feedback effects, so that's just sort of this idea that getting feedback on your life is helpful. Having someone just to talk to and listen to is useful. And then, so when we get really to the idea of the model or the technique that is, delivered, whatever the theoretical orientation is, the actual theoretical orientation of treatment only accounts for about 8% of 13%, which, like, for math people, Jessica, is a small number, right? You might have your mute on or care not to comment.
Yes, it's very, very small. Sorry, I had my mute on and I was shaking my head.
And then the model or the technique that's delivered, the sort of things we're talking about in here, the expectancy, the ritual, that's really only about 30%-ish of the 13%. So all of this is to say that while we are trying to get you to identify what your theory of counseling is, there's really no theory that's any better than any other theory of counseling. They're all fairly equally effective. And that's really because of the kind of common factors that they share. You know, and that's the stuff of the extra therapeutic things, the sort of relationship, the therapist effects. So the most important causal agents are the things that all of the theories have in common. And so what's unique to CBT versus, you know, solution-focused therapy is really, really tiny and really small. And just as kind of an aside, this is also, you sometimes will hear of this, is called the dodo bird effect. So this is a concept that's taken from Alice in Wonderland. And the dodo bird basically, this is something that Saul Rosenzweig came up with to illustrate the notion that all therapies are basically equally effective. And so this idea is taken from the scene in Alice in Wonderland, where a number of the characters all get wet. And in order to dry themselves, the dodo bird decides that they're going to have this competition. And everyone was to run around the lake until they were dry. And nobody cared to measure how far they had to run or how long they had to run. And so when someone finally asked the dodo bird, like, who had won, he thought about it and just sort of said, everyone has won and all must have prizes. So you can see, like, whether it takes you a little bit longer to get to the same place or it takes you a little less time, they're all kind of equally effective. And so a thing just to keep in mind is, even though these theories feel really different, their technical differences tend to not really amount to much. So anyway, not to throw cold water on the excitement of getting to pick out a theory and be convinced it's the perfect one. So kind of with that in mind, the major assignment that we're going to have this semester is to develop a theory of counseling. You might be wondering, how in the world am I going to do this? I just got into this program, or I want to be a school counselor. What difference does it make? Why do I need a theory? Well, I would argue you do. And the way you would kind of build one is that you would sort of start with a reflection of your own personal values and belief. You know, we ask everybody this question in our interview, like, why do clients come to experience, how do clients come to experience symptoms? Like, how do they find themselves in counseling? How do you think they become unstuck? And although questions like this might feel really overwhelming at this point in the first semester of your first year, I just encourage you to sort of start with where you're at with it. What does your, you know, and when I say where you're at with it, like, well, what ideas do you have from your family, from your culture, from your spirit, from your religious tradition? What do these parts of who you are tell you about the answers to these questions? It may not tell you a whole lot, but it's a place to start. And as you're kind of reading the theories throughout the semester, start to really compare your kind of like bag of ideas that you come into this program with, and see how well they match up with the theories that we're going to be reading about. Do they align with your experiences, your values, your beliefs? Some may make a whole lot of sense. I can promise you that some are going to feel like really outdated. Some are going to feel like kind of sexist. Some are going to feel heteronormative. Like, all of these things may not kind of, there's critique to go around for all of the theories we're going to talk about, in other words. And that's part of this process of this sort of dialectic between my beliefs and what I'm reading, and how do we resolve that? And the third step is to really consider how these theories will play out when you're actually working with clients. So this last part is something you're probably not going to really figure out until you're maybe like in practicum or internship. You may leave this class totally convinced that you are a humanist, and that you want to do person-centered counseling, but then you find yourself in your internship and you are working at Horizon Behavioral Health and their addiction treatment program, and you're just like, you know what? Person-centered really does not work with this population. I may need to adapt my theory a little bit. So just know that your theory is going to change either a little or a lot, but you got to start somewhere. So, in general, the schools of psychotherapy, and I use psychotherapy, and the other professors in the program refer to it as counseling. We are a counseling program, but I don't know, I was just trained to use them sort of interchangeably. And so anyway, I slip up and often use psychotherapy, but it's kind of the same. I don't know. I think psychotherapy is kind of a better word sometimes, but whatever. So the theories we're going to be talking about are usually divided into 4 separate waves. They tend to be chronological, although for each of these theories, you will find a kind of new or a neo version of each of the theories out there. So you will find, you know, neo-Freudians out there. You will find neo-Lacanians out there. So all of these kind of old ones that maybe came up during the Victorian era are still sort of present, and they're still sort of relevant, and they've been updated over the years in various ways. So just kind of know that they never really completely disappear. So we're going to just kind of go through these generally, and you will be obviously watching lectures online about each of these. You're going to be reading about them. You're going to be watching people demonstrate different techniques. So the first theory, the first wave, is called the psychodynamic. Often it's also used as the psychoanalytic tradition. I tend to think psychodynamic is kind of a better word, because when we talk about the psychoanalytic tradition, often people get the idea of psychoanalysis that's, you know, free association on the couch 4 times a week for 5 years, which is really not done outside of like San Francisco, LA, New York, and Boston, maybe Philadelphia. But anyway, it's not done, but there are plenty of people who use a lot of the same ideas as Freud, but they consider themselves psychodynamic. So this first wave, so obviously the father of psychology and counseling was Sigmund Freud. And Freud really stressed the importance of these inborn drives, particularly sexual drives, when it comes to personality development. So he thought that like childhood sexuality was how we ended up becoming the adults we become, but is also the source of mental illness. And so that was the kind of first one here. You can kind of see psychoanalysis. And then next came Jung. And so Jung, more so than Freud, Jung was really interested in the role of the unconscious. So Jungian therapy works to help clients make the unconscious conscious. And you'll learn a bit more about what that entails. Like, how do you know something that you don't know, right? He was also really fascinated with symbols of universal patterns, dreams, fantasies. You know, the kind of Jungian archetype is something you're going to read a lot about. And also kind of another early person then was Alfred Adler. And Adler was, you know, in the Freudian society, the psychoanalytic society, and he was a sort of follower of Freud, but eventually he sort of broke with Freud, just kind of like Jung did, because he thought that Freud was way too focused on sexuality. And instead of focusing on sexuality, you know, Adler was really interested in young and early childhood experiences, but he was more interested in kind of how the family informed personality development and also mental illness. So that he, in a lot of ways, Adler kind of becomes the sort of father of marriage and family therapy and counseling, which probably all of you guys will take at some point, which I also teach. And then after that is this other one called object relations. So object relations, just generally, If you don't get it, that's cool. This is a complicated one. Really emphasizes the importance of the environment and the kind of early bond between mother and child. And that when that bond is not kind of like healthy and secure, that's when children develop pathology and problems. And related to that, again, is this idea of attachment theory. So the first person to kind of come up with attachment theory is this British analyst called Winnicott. And he really emphasized the importance of the child-mother bond. He sort of recommends this idea of the good enough mother. And his early theory really focused on attachment in children. But like I said on the previous slide, a lot of these theories have continued to be relevant and to revise based on what science has told us. And so a lot of the kind of attachment-based psychodynamic theories that are out there right now are much more interested in kind of adult attachment and in sort of romantic relationships. So that would be like emotionally focused couples therapy. And also this kind of relational two-person theory it's attachment based, but it's really interested in the attachment between the kind of therapist and the counselor. They sort of conceptualize it along those two lenses, along those two ideas. So that was wave one. That was a lot of 40 years of counseling explained in one slide. Okay, we'll move on to the next one. Number two is the cognitive behavioral tradition. So this is really the second wave here, and they're usually lumped together. Yeah.
Really quick question. You said that was the counseling, correct? The theory one?
Theory one, that was psychodynamic.
Psychodynamic. Okay, I forgot to write that part down before.
Yeah, no problem. No problem.
Okay.
I can switch back. Yeah, you can see theory one, the first
Okay.
wave, psychodynamic wave. And thank you for speaking up and letting me know. I'll just prattle on because I can't see anyone. I can only see a couple of people. And then theory two is the cognitive behavioral tradition. So this is kind of divided out between people who are really interested in just the kind of behavioral approach, and the two people that were kind of influential in the behavioral tradition, first of all, was like Pavlov. So remember the dog experiments with classical conditioning where the dog would start to salivate when it would hear a bell. Well, that was really used to, all right. That was really, okay. All right, so I'm gonna start back on this one again. So this theory, no, I'm gonna keep going with it. So behaviorism uses this idea of kind of learning theory, either classical conditioning, the stuff that's sort of rooted in Pavlov, or Skinner's operant conditioning. So that's sort of like behavior modification, applied behavior analysis. But both of these are really learning theory to kind of try to change people's behavior in the world. And this was really emerged as a reaction to the psychoanalytic tradition. Whereas the psychodynamic tradition, nothing is measurable, everything is in the mind, everything is in the unconscious, these kind of hidden repressed memories. Like the behaviorists in particular really were just like, the mind is a black box and we really don't care about it. What we care about is what is observable. What's observable is just people's behaviors. And so that's how behaviorism kind of developed as a tradition. It was much more about shaping behavior, recognizing that we can reinforce behaviors we want, or extinct out behaviors we don't want. These still are in existence now. Sort of the modern forms of it would be obviously applied behavior analysis, which is very common with children on the spectrum. And then some of the exposure therapies are very common. So for treatment of PTSD, any kind of trauma, there are a lot of traditions that sort of use this idea that, you can train people to sort of relax and you can expose them to increasingly more anxiety inducing situations. And eventually they start to, it starts to normalize and they can kind of be around something that is anxiety provoking for longer periods of time. But we're going to learn all about that in a couple of weeks, just a brief overview. And then the last one, the sort of other thing, the sort of cognitive part, which certainly draws from the behavioral tradition, but is often has a sort of more cognitive, meaning thinking, beliefs element to it, came about as well with this wave. This is also part of this wave. And these theories really assert that how we think about the world, so how we're thinking, influences how we feel and how we behave. And if we were able to change how we think about things, we can also change how we behave, how we feel. And so some of the early ones in this area would be kind of cognitive therapy, Albert Ellis, and then Aaron Beck. So rational motive would be Albert Ellis, and then cognitive would be Aaron Beck. And, they both thought like people have crooked thinking, and when they can change their crooked thinking, then things get better. These also include kind of newer versions of cognitive behavior therapy. Things that you may have heard of before would be DBT, dialectical behavior therapy. This is considered a cognitive behavioral tradition. ACT is another one, acceptance and commitment therapy, which is another one that's pretty common. And then a lot of the kind of like mindfulness-based CBT, these are all in this kind of second wave here. And they're really good at treating things, they're good at behavior change, they're good at symptom reduction.
I'm really drawn to this. This is great.
Good.
This is just, I use EMDR for my PTSD with my counselor. It's amazing.
Yeah, it's good stuff. It is good stuff.
I like to see this big picture. Thank you.
Sure. Yeah, no problem. You're going to see a lot of this big picture. I assure you, this comes up in like nearly every slide of my lecture. You'll be like, really? It's this thing again? Okay, so the next one. The next one is the existential humanist tradition. So obviously most counselors kind of see themselves, I would say most counselors, but all of us, this tradition has been very, very influential. And if you sort of think about psychodynamic theory and you think about behaviorism and cognitive behaviorism, particularly the older versions, like they were very deterministic. And, for Freud, it was like unconscious motivations were sort of driving who we were. Behaviorists, it was about like reward and conditioning. That's how we ended up the way we were. We didn't really get to choose. And the sort of next wave, the existential humanists, were much more, were really critical of this idea that humans were deterministic. And this view of human nature just sort of didn't seem to fly. And so these theorists really thought that at their core, human beings are free, and they're free to choose who they are. And really, if it's starting to sound like your philosophy class from undergraduate, that's because these guys, a lot of the sort of existentialist thinkers were influenced heavily by this tradition, by this wave, and this wave was heavily influenced by the philosophical tradition.
This be an example, sorry to interrupt, would this be an example of like self-actualization?
Totally, yes, exactly. So Maslow fits in, Maslow's hierarchy of needs really fits in well with this. And Maslow was like massively influential for all of the people that are in this tradition. That's great, yes, definitely. And these guys are really interested not only in this idea of freedom and free will, but also seeing sort of the primary virtue and like what humans are striving for is to be more authentic. And when we say authentic, it's so that like this idea that we're not being this false version of ourselves, that who we truly are inside is congruent with who we are when we show up at work, when we show up in our relationships, when we show up at school. That's really this idea of authenticity, and that's really this great value here. And there are four big categories of sort of existential humanistic theories. They're important, so we kind of hit them hard. The first one is person-centered. So this is Carl Rogers, if you guys have perhaps heard of Carl Rogers. And he really believed in the kind of core conditions of unconditional positive regard, empathy, and genuineness. This is a confession that I may have in a video at some point, but the first day of graduate school, and I went back to get my counseling degree, like I actually raised my hand and asked the professor, like, who is Carl Rogers? I've like never heard of this guy before. And luckily he was really nice and sweet about it. All of which is to say, if you're hearing these names and you're just like, who are you talking about? Even if it's like Carl Rogers, who's pretty important and influential, like, don't worry, one day you might be teaching this class. That's where I started. I'd actually never taken a psychology class until grad school, so.
Yeah, I've only heard of Rogers because at ThriveWorks they have him, like, quotes by him and Albert Adler. So
Yeah.
I was like, that's the only way I knew who it was until we talked about him in professional.
Cool,
counseling.
yeah, yeah.
So-
Well, there will be lots of them that each of us hear about, and you know, I'm still learning new theorists. So the next one is Gestalt, which is a sort of juicy German word that is a theory of counseling that was developed by Fritz Perls. And it really is about encouraging people to become more aware of themselves and others, and encourages responsibility for the self. The next one would be, and out of person centered, sorry, I skipped over that, is motivational interviewing. So motivational interviewing is like huge right now, and it is considered a sort of person-centered approach. It's great for health problems, for addiction issues, for getting people motivated to change. So definitely just kind of know that motivational interviewing is one you're going to hear a lot through your career. Then the existential therapists, so Rollo May, Abraham Maslow, and these guys were a little bit weird. Like they didn't necessarily have a set of fixed techniques, but they were just these therapists who really emphasized that their clients work out personal responsibility, talking about death, how to create meaning, how do they move towards self-actualization after they've met their basic needs. And then lastly is reality therapy. So this is Glasner, and it assumes that people are responsible for their own lives and for making choices about what they do, feel, and think. I would not suggest that reality, like theories, all of these theories work pretty well, or there's a version that works well with children as well as with adults. Reality therapy is the only one that I feel like is a little bit contraindicated, meaning you may not want to do this with somebody who's like under the age of 24. Because, you know, like we know about cognitive development, people don't have their frontal lobes left. So that would just be my like one thing is, you know, if you're thinking about what population you want to work with, if you want to work with anyone under the age of 24, I wouldn't recommend reality therapy. You may not like it in general, so it's usually not that much of a problem, but I did have a student who was a school counselor a couple years ago, and she was like, this is my theory, and I was like, you know, I should have said that at some point beforehand. So anyway.
Sorry. So all these theories are kind of centered on the client, it's themselves, whether that's like kind of like self-motivation, it's like kind of getting them to explore themselves a little bit, focused on them more than, I guess, togetherness.
Yeah. Yeah. I mean, all of these are pretty individualistic, I would say. And, you know, it sort of takes the sort of self as, you know, how do you as a person have a meaningful existence, recognizing that like you will die alone. It's bleak like that, but yeah, this one is very much about like taking responsibility for yourself and being more individualistic. And the critique of that, I think, is really what motivated the fourth wave, which is the sort of constructivist wave. So as you may have noticed, a lot of the theorists we have talked about, with the exception of object relations, a woman named Melanie Klein, they're male and they're white and they're educated, and they sort of regarded themselves as more or less the experts who knew what needed to happen for healing. And so that obviously becomes more problematic as we start to move into, the 50s and 60s and the civil rights movement and the women's movement and the gay rights movement. People start to sort of say, like, these things can't all be sort of centered around this kind of like, white male heteronormative myth. Like, there's just more out there in the world. And so the constructivists really were trying to kind of come up with a theory of counseling that would be applicable to people throughout the world in different cultural settings. And to kind of recognize that there's like wisdom and knowing that people have, that the counselor isn't necessarily the expert, the client is kind of the expert. Constructivism suggests that clients really can be their own theorists, that they have meanings and views, that they assign things to their lives. And that's really critical. And that's kind of the role of the therapist, is to kind of like help unpack that and help elucidate that. And it also recognizes that truth is subjective and that it's bound up in culture. So you can't kind of separate those things out. And so this kind of notion of truth as being culturally bound, of being kind of in a multiplicity that's kind of rooted with individual, this is kind of where the way, like feminist theory started to really come into its own in counseling, and, really started to critique psychodynamic theory. And it really emphasizes the kind of role of society and politics in creating problems in people's lives. And that's particularly true when there are gender and power differences in relationships, that is the root of problems. That's what brings people into counseling. And kind of combined with cultural theory, sorry, I'll skip that one. And then another one that's kind of related to this is sort of solution focused. And like I said a minute ago, like the clients have their own solutions. Well, solution focused therapists really think clients do kind of know what they need, and they have everything that they need to solve their problems. And what has worked in the past is something that can kind of work now. This is kind of a collaborative process of discovering what some of those solutions are that maybe they didn't realize were solutions or were kind of afraid to try. And then lastly is sort of narrative. And the narrative approach sort of views clients' problem as stories, and through the process of counseling, you can start to sort of change the story that people have, so that they are rewritten in ways so that there are more positive endings, so that people's stories are those of power or efficacy. So that's kind of narrative therapy.
That sounds a lot like my life coaching training. It's really built off of the client knows best, and they need to do like dig deep.
Yeah. It's I think a good intuitive theory. I mean, we'll talk about ways in which it's not that helpful, but
Especially the narrative. Yeah. Okay, cool.
But yeah, good parallel to draw there, but maybe not for everyone. You may be thinking, hey, can I select more than one theory?
Yes.
A lot of those theories make sense, right? And you're right, they do. However, honestly, most therapists and counselors consider themselves either eclectic, meaning they use sort of multiple theories and interventions at once, or they're integrative, meaning they merge theories and interventions. So knowing eventually when you get out into the world, you're going to end up probably moving in that direction. But as a new counseling professional, I would say your task is to find a theoretical orientation that fits for now, knowing that likely you'll become an integrationist down the road. So that is kind of my theory. And as you'll see in the sort of assignment for that, you know, combining theories is pretty complicated, and I just always encourage people to sort of stick with one to start with, knowing that you'll probably go that direction anyway. Questions?
What's your theory that you go with?
Gosh,
a good-
well, I think that for me, I'm pretty like psychodynamic in my orientation. I really think like attachment theory is really, really, really powerful, and also sort of tend to sort of think that way about childhood experiences being kind of influential and the kind of times, and, you know, and just and kind of looking through things through an attachment lens. And I sort of think that way, but sort of act more, I think, in the existential humanist tradition of sort of, talking about the relationship, about what's happening now between us. So in that way, I'm a little bit of kind of an inconsistent thing that I conceptualize in one way and I kind of behave in a different way.
Yeah.
But I tell you, I have used all of them and, thought for a long time that CBT was the one that was going to be good for me. And, so I've bounced around a lot and probably will continue to bounce around as long as I live. Yeah. Anybody have... Go ahead.
Oh, sorry. I was gonna say finding the one that works with that specific client is really important because people are so different. And I see that every day in the ED where I got this one person who's calling me names the whole time, but really just wants to talk about what's going on. And I have another person who you're like kind of drag it out of them. And so it's very interesting for sure.
Yeah. I mean, in the emergency room and, hospital like that, you really do see all levels of people who are like, actively psychotic to people who are, worried and well and are going through like a developmental life change, and are feeling like their life has no meaning or they don't know how to quite cope with the challenges facing them. So, yeah. Good. Any questions?
I have a question. So in my life coach training, and this kind of could go, I think it can intersect with that idea of you can't go where you haven't been yourself with your clients. We have this, like, of course, in counseling, if you're working in a facility like behavioral health or psychiatric ward, you're not going to be able to control who, for life coaching, clients are attracted to how you present yourself when you market, basically, because that's how clients find you. Would you say it's similar if you have worked in like a office setting where clients kind of come to the office, like ThriveWorks? Do you find that it's clients you help the best have been you've been in their place like 6 months to a year ago? Because that's the rule in life coaching when we first start out with training. So I wondered if that was taken from the counseling, like a counseling theory.
I would probably say like often you work best with the people that you haven't had their particular life experience with. I just think that there is so much temptation, and we'll talk about this with Freud, to have what we would call a countertransference. And that can ultimately sort of be dangerous. And so you just really want to make sure that if you're ever disclosing something about your own experience, some problem maybe that you've had that the client is also having, like, you really don't want to share that unless you're really sure why you're doing it. So I know certainly life coaching is like, oh, well, this helped me when I wanted to do X. Like in counseling, is a really dangerous thing to do. In part because I think it's about you kind of like working out your own, potentially can be about you working out your own stuff. And, that is not at all what the kind of client is there for. And so I always just sort of say with self-disclosure, make sure that you're sort of doing it for the client's best interests, because it can really go awry and it can really impact the relationship.
What if they straight out ask you, have you ever, because I've caught myself doing that with my counselor, I'll ask her, like, have you ever went through this before? Because I just am trying to get like in group counseling, they say it's like you, you learn from other people, and you get like, I'm not the only one that's going through this type of deal. When that happens, is it okay to like tell them your experience, or is it still like just use your best judgment?
Well, I think, this is one of those questions that says it depends. And I think to some extent, it really depends on what your theoretical orientation is.
Okay.
Whether or not you would do that. I mean, some of them are much more like, particularly like feminist approaches would absolutely be like, it's much more egalitarian. It's like, I'm going to talk about my experiences and what that is like. And that's, I think consistent with the theory. The psychodynamic theory, or even to some extent some of the existential and humanist ones, I think would be really reluctant and careful about answering the question, because oftentimes like the explicit reason a client is asking is not actually the reason that they're asking the question. And so, and I know that sounds like a kind of cagey answer, but a lot of times, like, there's sort of more motivation in understanding it. So I'm trying to think of a good example of that. I mean, I think I try to talk about it more in terms of like the process and what it means for our relationship. So, people will ask me like, do you have kids? And I will be like, what does it really mean? I see that that's an important question to you. Can you kind of help me understand why that is relevant, or why that's important for you? What would it mean if I did have children? What would I mean if I didn't have children? How would that be different? What parts of your experience do you think I wouldn't understand if I didn't have children? So like, before you disclose anything about yourself, you really want to just like, okay, what does this mean about our relationship? What are you trying to ask? Because a lot of times people, what they really want, like they think that they want to know something about you, but really what they want to know is like, are you going to be able to understand me? Are you going to be able to be close to me? Are you going to be able to like understand this perspective that I'm in? It's just this like basic sense of like alienation in the world where no one in their life really gets them. And are you going to be this other person who's not going to kind of get them either? And rather than just saying like, oh yeah, I'm going to get you, like you can't do that directly. You kind of have to like, you have to sort of show it, and this is another thing that I think is just really a profound thing to know, and like something I learned in the process of making mistakes and disclosing stuff that was not really particularly helpful or useful, is that there are lots of types of knowing. For instance, like you knowing like the Facebook details of my life is not the same thing as knowing how I am. And, you may not know whether or not I'm married, but you do know how I laugh, and you know how I respond when you say something that moves me, and the way that I am, how I am, that is not like the facts or the details of the biography. So I like to think about it like that. But I'm much more for the psychodynamic tradition, which is much more like, it's kind of got a little bit of the blank screen about it. So good question though. I'd be curious to hear what the other members of our faculty said about that one.
Thank you.
Mm-hmm.
I'll try to like ask all of them, because that would be good to see different perspectives.
Yeah,
I mean, not that, yeah, you might have similar perspectives actually. Too.
I mean, you're going to get this a lot around here is like, are you religious? That's a big one. So.
It kind of sounds like to me that counselors, or as a counselor, you should be able to get to the crux of the matter faster and sort of cut out some of the small talk is what I'm getting. And a lot of people maybe feel more comfortable starting off with small talk, maybe things that are unimportant or not the true issue at hand for themselves. Can you speak to that at all?
Oh, yeah. There's like a phrase in my grad program that we would call it dumping the dragon. And that is like where you have a session with someone and, they're talking about something and you're thinking to yourself, is this really, I don't know. And it's usually like a work complaint or some sort of like content problem that's this long. extended story, and you're just like, really, is this what we're doing? Is this what we're focusing on? And then like inevitably 5 minutes before your session ends, they will sort of share something that is like large and significant and profound, and you're like, okay, this is what's really going on. Don't I wish we had talked about that earlier, because now we only have 5 minutes left. And, you know, I mean, sometimes it's safer for people, like they're not really ready to talk about it, and so they'll sort of dump the dragon at the end of the session, because it is easier, or they're avoiding it. I mean, they would call that resistance or something like that. But I think it's just a natural impulse to sort of protect yourself and to not be too vulnerable, because it is like very vulnerable to sometimes talk about the things clients talk about.
Oh my gosh, I've done that to my counselor.
Sure. Yeah. I think probably everyone does.
Okay, that's good. That's awesome. I mean,
Yeah.
it's, you know, to identify, I figured it was a way of, you know, like getting safety to build up to the deeper.
Yeah. I mean, you have to really, I think, build a lot of trust, and it's hard because, like I said, this is not a reciprocal relationship. This is a relationship that goes one way, and you know, we think about our friendships. Sometimes it feels sort of safer, or partners, like when they disclose, we disclose, and that sort of builds this sense of safety. And certainly in a group environment, that works really well. But it doesn't really, that doesn't have a correlate so much in individual counseling, and so. Yeah, it just you just kind of have to let people and know that they're not ready yet. So, yeah, good questions.
Are there any like kind of like when that does happen, are there any kind of like leading questions that you could ask to kind of have them so you're not really kind of waiting for a very long time? It's kind of like, are there any like specific wording or I guess sentences you can kind of like not push them along but kind of like get their attention, like, hey, there might be something else going on, like we could talk about that or something, if that makes sense?
Yeah, I think there are lots of ways to do that. I think, you know, I have a friend who went to grad school with me, you know, and he works a lot with children who are in a juvenile detention facility. And sometimes what he'll do is get the clients to like write all the topics on like popsicle sticks, and he'll put them in a cup, and then he'll be like, we don't have to talk about these now, but we'll just put them here, and then we'll just kind of grab one out. And so it's just kind of, I think, a way to be like, we don't have to talk about this thing yet. And, you know, I think it's also important to really recognize that even when you're talking to somebody with, you know, with trauma, like I mentioned, trauma is trying to expose them to the traumatic event again. Like that's way, 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 way down the road. And so often I think like not asking people to sort of share before they're ready is just like good, and to sort of be really transparent and to sort of say like, I know there are things that maybe I don't know about, and I know that you'll tell me when you feel like you're ready, and I'm here to hear them. So, and you know, sometimes like if you have a good relationship and you've been working with a person for a while, you can push a little bit. You can be like, I think you are trying to avoid talking about something. I feel really disconnected from you, and I'm wondering where you are today. Things like that, I think, can kind of be useful in relationships that are sort of long-standing, to get people to perhaps open up when they're maybe avoiding something.
What are some leading questions that we should most certainly avoid, but may fall prey to early in our career?
Did you talk to your roommate yet? Is a good one. Don't ever say that. That would be a good one that I would avoid at all costs.
You see that on movies too.
Yeah.
They're telling us the wrong thing.
Yeah.
Cinema, not trustworthy.
I know. The counselors get like terrible. They're always almost always monsters in movies, one way or another. Yeah. You know, the thing is like, I remember this feeling a lot of like, oh my gosh, I'm going to say the wrong thing and I'm going to like hurt this person, or they're going to get really upset or mad at me. And the kind of sin of commission, like saying the wrong thing, I've often found is sort of worse than the sin of omission. So sort of not saying something, not expressing yourself, not taking the risk is often worse, because what we, this is all about the relationship between two people. And part of relationships is being able to kind of have this rupture where you might say something that's like stupid and doesn't work, but you know it and you can call yourself on it, and then you can kind of talk about it and apologize, and then you can kind of repair the relationship. So it's like, becomes kind of a model for how people can have healthier relationships, is this sort of like rupture and repair, which just means like, you want to be careful. Like, you don't want to say to your client, you look really hot today. Like, that's not ever going to be a helpful thing to say. But most of the time, you can, if you have a good relationship, you can recover. And sometimes the things that are like out there and that are risky, they work really well. I used to like, I don't know, I was working at a counseling center once at JMU, and I kept getting colds, and sometimes I would be like on cold medicine, and like I would do some of my best work when I was just on like cold medicine, because it would somehow suspend my anxiety about saying kind of like wild out there things that I was thinking. Like my reluctance or my anxiety would just get kind of like suppressed by the Sudafed or whatever, and I would just sort of say it, and it would usually go well. It was always really surprising. I was just like, how am I doing my best work while I'm hopped up on Sudafed? Which is just to say, like, sometimes the risky things are the things that work really well. You'd be like, is Dr. Metz on Sudafed today? Her teaching's good.
That's awesome. Dr.
Might
Metz,
be like
yeah. Oh, sorry.
No, go ahead, Jonathan. Sorry.
So, I was going to ask you, I know you did the ED evaluations, and we get this short period of time, and we get their whole life story, and then you have to make a decision. And there's only been a few times where, like, I wasn't able to have good conversations. Well, I mean, not including the psychotic people, that's a little different. But how did you slow down from like, getting everything in 45 minutes to, I mean, not everything, but you know what I'm saying, to, okay, let's go at a pace that's, not rapid. How did you slow yourself down? Because a lot of these people do answer the questions, and they're like, man, I really needed to talk about that. Yeah. And so it's hard to like, okay, take it all the way back and don't ask those questions. How do you, go ahead. Sorry, I'm not going to interrupt you again.
Well, I think, part of it is that I did outpatient traditional 15-minute counseling before I did emergency evaluations. And so just then it was like me picking up my pace.
Okay.
I mean, I think it's just learning to like keep your mouth shut and wait and use silence. And I would sit on my hands a lot just to kind of keep myself from visually jumping in, breathing. Silence is like incredibly powerful. So I think it's just kind of, that's one of the helpful things about slowing down, is just sort of learning to trust that if you don't do anything, eventually
it'll get there.
Eventually the person will speak up, because all of us hate awkward silences, right?
Yeah.
Good question though.
Thank you.
Sure. Well, we'll talk a couple more. Any other questions, and we'll just wrap up around 6-ish.
So going back to creating our own theory, would you say as starting out, it might be best to take the bus stop approach of, it doesn't have to get you all the way to your location, doesn't have to fit everything, but you kind of want to just go as close as you can to what you want to do?
Yeah, I think that's a great way of doing it, that you're still going to have to do some walking there. But I think that, I promise that you'll find one that you read, or will watch a video, or you'll do a demonstration, and you'll just think like, yeah, that kind of works. I can sort of see how that's helpful for people. And admittedly, most students in counseling programs sort of start out with CBT. It's just a good one to use, in part because it's pretty structured, and yeah, it's just really structured. And, you know, there are manuals out there and you can kind of practice, and like, it's a little bit scaffolded, you know, it's not like it's just easier in that regard. And it has kind of like an endpoint and you know what you're supposed to be doing. So, but I have a feeling we're going to have some wild cards in here, get some interesting theories going on. Yeah, I had a student, I guess 2 years ago, who kind of blended feminism and Jungian theory, and we did like a counseling demo with it, and she did like a tarot card reading counseling session. It was like very creative. So she,
Oh my God, I was thinking that myself. I was like, I'm gonna do Jungian, behavioral theory, and feminism.
that might be a little bit too much to blend.
I know. I was like, this is, oh my God, that's so funny. Sorry, keep going, tarot card readings.
Yeah, so it was just like a really kind of creative thing, but you know, it worked because you could see the theory, you could see both of the theories that she was sort of working with in terms of how she was. So yeah, I liked it.
I'm really excited about theories. I really like the foundation. So I apologize if I am reacting to a lot of things.
No, I think it's
super
great.
excited.
It's an awesome class. You guys are gonna love it. It's gonna be really fun. So anyway, and please keep in mind that if you come across things, like just schedule an office hours meeting with me. You know, obviously we're not going to be meeting face to face because Zoom stuff is challenging, and the lectures are recorded, and you know, you can kind of listen to them on your own. But I'm always up for chat, and then yeah.
Awesome.
So I will say I tried to go back and watch that video of the lot, and it only gave me 11 seconds. So I don't know what I was doing wrong, but I tried on the computer, tried on my phone, and it was like 11 seconds long. So
All right,
I was like,
probably what I'm going to do
is more than that.
let me just I'll upload this one and then the one from last week up to YouTube and then post it again.
Okay. Thank you.
Yeah.